loss drug may help do more than just lose weight. Wegovy was shown to reduce the risk of heart attack, stroke, or heart-related death by 20%. What's being called a landmark clinical trial. Joining us to talk about this, Dr. Bill Hartman just happens to be a clinical trialist at UW Health. Great to see you, Doc. Wegovy and its sister drug Ozempic, they're just gobbling up all the health headlines lately. Doesn't it seem that way, especially for what they've done with weight loss? But this is even better news specifically for Wegovy.
Well, it is. And again, this is a similar drug to Ozempic. They have the same parent compound within them. And Ozempic had already shown that in patients with diabetes, when they take Ozempic, there was a 26% decrease in heart attacks and cardiac issues. Now, in people without diabetes who take Wegovy for weight loss, they're seeing a similar 20% decrease in the number of heart attacks that these patients develop. Where that's important is that if this holds true and if it continues to show this 20% decrease, insurance companies may be much more likely to go ahead and pay for this treatment as a form of weight loss for patients to help them reduce their overall cardiac risk. Significant because in the absence of insurance paying for it, we're looking at a cost of about $1,350 a month.
Yeah, I mean, do you have an extra $13,000 to try and lose some weight here? That would be a game changer when it comes to weight loss, because historically, insurance companies, you say the word weight loss, I want to take a drug for weight loss, that's like almost a straight denial for a lot of people.
Right. You know, there's a lot of weight loss supplements and the such out there that people already take and spend billions of dollars a year on that are not paid for by insurance companies. They've been looking for a holy grail medicine like Wegovy and hopeful that a drug like this really will do good things in terms of reducing people's overall medical risks as they go through life, and reducing weight is such a huge part of that. And so that's where a drug like Wegovy, and especially if insurance companies pay for it, will be of huge benefit to many, many people.
Let's talk about the side effects a little bit, because it seems like we're kind of learning some new things as the drugs are taken in the long term, especially in Ozempic, because so many celebrities for some reason have been taking that, not even designed for weight loss, it's designed for diabetes. But is there still question marks with these drugs?
Well, there is. And in terms of is it causing permanent effects to the stomach? And so it decreases the stomach emptying time, so that the food will be sitting in your stomach for a longer period of time. You feel full, you don't want to eat more food. But over time, are we causing problems with the stomach by preventing it from being able to empty itself and have people have the food and nutrients pass through their bodies? This is something that's probably a theoretical risk at this point, but it has to be continually studied so that we know that when we're giving these types of medicines to people, they're doing what we want them to do, but they're doing it safely.
And with 40% of Americans about that obese in this country, there are so many eyes on these drugs that could possibly change a lot of lives. We'll keep talking about it as the new information comes in. Dr. Bill Hartman, appreciate your time.
Thank you.